The views and opinions expressed on any program are those of the producers and/or the persons appearing on the program and do not necessarily reflect the views and opinions of FRC Media, Bristol Community College, or the City of Fall River.
Welcome once again to our view on public safety. My name is Richard Aguiar, the Director of Fall River Emergency Management and the Chief of Special Services. Today I have a couple of guests from EMS Division, Captain Matt Adams and Lieutenant Matt Lockhart. Today they're going to talk about home health care for the shut-ins, correct? Or people that really can't get out. They have quite the program, and I'm going to start off asking the Captain and Lieutenant some questions. So let's talk about the CARE program. What is it all about?
Yeah, so the CARE programs is one of the many programs that we offer to the citizens of Fall River. We're partners with Bristol Aging and Wellness. We serve residents of Fall River that are above 60 years old. We'll go to their house, start with a home safety assessment, and make any referrals for services that they may need. That could consist of Meals on Wheels, VNA services, PCA services, health assessments. We'll do medication reconciliation. We'll go through all their meds, make sure that they know how to take them, the frequency is correct, understand the side effects, understand why they're taking them. A lot of times we find people take medications just because their doctor tell them to. They don't actually understand why they work. So there's a big educational component to it. If they need heating assistance, we refer them to the proper resources that they may qualify for. The great thing about this program is that it's completely free. If you qualify because you're 60 years or older and you're in Fall River, there's no cost to you at all for us to go out there and do an assessment. It takes about an hour or so. Some other things we may provide is a lockbox. So emergency services could access your house in the event of an emergency. We'll make sure that your house is visible from the street. You have adequate lighting, numbers on your house. That way, if you call 911, they know where they're going. They can get in your house. We do other things such as a lot of elders, we notice a big problem is mobility. They fall a lot, and unfortunately, at a certain age, once you fall and you break something, you end up in a nursing home, and that really affects your quality of life.
So one of the things that from experience dealing with my elderly parents, was scatter drugs. Get all the scatter drugs off the floor because they won't trip over those things. Is that correct to assume that as well?
That is a big part of the program. We always recommend removing the rugs. Mm-hmm. Fortunately, a lot of the people, their possessions mean something to them, right? So we'll try to compromise, at least tape it down. That way, it won't flip up and cause somebody to trip.
Mm-hmm. So the correct name of your program is Integration Healthcare Division, correct?
No, it's Mobile Integrated Healthcare.
Oh, mobile healthcare. Okay.
Yeah. So that's a broad term, and that just in Fall River EMS, mobile integrated healthcare, pretty much encompasses anything that's not 911 related, or training related, or quality improvement related. So we have several different programs. We place a big emphasis on community paramedicine, which is paramedics that work outside of the traditional role of being an emergency paramedic, but work more with prevention and wellness and trying to keep people out of the hospital before it gets to a point where, it's an emergency situation and you need to go because you're really sick.
So let's go to some topics that you gave me here. Blood pressure and wellness clinic.
Yeah, you want to talk about the blood pressure?
Yeah. So that's another
in-house, correct? Is it all in-house?
So actually, it's all done along with the senior centers throughout the city.
Oh, okay.
We offer them at every major senior event, at least once a month, at every center in the city. And it's part of an outreach program alongside our CARES program. So we always show up. Usually it will be some sort of game or other event that they're hosting. And we do blood pressure, heart rate, blood sugar checks, and we actually have these cards that the folks who come to repeated clinics can use to track how they are over the course of each clinic. So that way they can see sort of trends, they can show these to their doctors, and they can maybe catch things that are changing over time. And we use that as a way to talk to these people and reach out, teach them about the other CARES program services, and most of our referrals for our home visits come from the wellness clinics.
How about high rises? Do you go to high rises as well to do this stuff?
Yeah, so we do. That's actually part of our breakfast and serve program.
I was going to ask you about that as well.
Yeah, the breakfast and serve program is something in the high rises, usually hosted in the community room, where they'll have either a pancake breakfast or something along those lines. And we'll always have a table set up at these events where we do the same thing: blood pressure clinics, healthcare education, and referring people to our home safety visit program.
So do you have a lot of people that actually come down for those services that you guys render? Or?
Yeah, definitely. So we, over the past year, we had 207 patients that we, or elders that we either contacted in the wellness clinics or in a home safety visit. And most of those, when you look at our statistics, are repeat customers. You know, they're at every single event, or they're at every one at a particular senior center. You know, we'll have people who, you know, make 12 months and they have 12 visits. So we have a lot of repeat customers, and we this year are set to exceed that 207.
So, Cap, you mentioned 60 plus now. Not everyone in a high rise is 60 plus. Can anybody come down? You have to be 60 plus.
No, anybody can come down to the events that we have set up. We're never going to turn anybody away. We'll help anybody possible. But to be part of the actual CARES program and get an in-home safety assessment, that's where you have to be 60 plus.
Okay. You had mentioned the breakfast serve. Is that you actually the pancakes and stuff? So they come down and they get their services from you guys as well, correct?
Yeah, so they'll get a free breakfast. We don't actually do the cooking. You don't want me cooking pancakes for sure. I believe the director of the housing authority usually is the one who does the cooking and sets all that stuff up. We're just there strictly to, you know, educate people on medicine, pretty much.
How about movie night? What does that pertain to?
So another great thing that we do, and in conjunction with the housing authorities in the housing project centers like Sunset Hill, Father D. DeFerrio Village, Maple Gardens, they set up movie nights in the summer. So they'll have an outdoor movie, they'll have all the kids from the place that want to come watch the movie, and we set up a paramedic there. One, to engage with the community. We want people to know what we do, why, that we're there for them. And two, for a safety reason. We actually, over the last summer at Father D's Village during a movie night, a child choked on a bottle cap.
Oh boy.
He started turning blue. Luckily, our paramedic was there. Intervened immediately, got the bottle cap out of the kid's throat, and he went on to watch the rest of the movie.
Wow. So it's a good thing you guys were there then, I guess, right?
Yeah, it was. It's a great moment.
Vaccines. Now, you have listed here vaccines as well. What does that actually pertain to? Do vaccines at these high rises and home visits and stuff such as that?
So we have a couple vaccine programs. We do offer them in the houses, the high rises, and throughout the entire community for elders at home and people who are generally unable to get out to get their yearly flu or COVID vaccine. So we have a whole system by which we're able to transport the vaccines safely to their home, administer them in the home, and make sure it's all done safely, and that they can receive that yearly protection that they need. And And additionally, we have participated in the Vaccines for Children program with Fall River, the PACE Center over at Fall River Public Schools, where people who are, children who are coming into school but are not yet vaccinated, we work alongside the state to have a supply of vaccines that we can then get them caught up on what they need in order to actually enter school.
These kids can't start school until they get these vaccines, so it's crucial that they get them in a timely manner. Sometimes they wait weeks, months before they can see a pediatrician. So we'll vaccinate them, get them so that way they can get rolling in their classes. And we're actually going to be adding to that, setting them up with backpacks, school supplies, anything they may need to get through the school year.
So I don't know if it was the flu vaccination I received or if it was COVID. Nick Silva actually was there to give vaccines out as well at Government Center in the Health Department. Do you guys still do that as well? Do you guys do that also? Or?
So our vaccine center is based at a government center. That's where we keep everything. We are mobile, so we can go anywhere in the city. So yeah, during flu and COVID season, somebody could come to the government center for vaccine. Yeah.
So we just touched on home visits. What does home visits consist of for the elderly? So they call you guys, say, I need a home visit, like a doctor's. Back in the day when I was a kid, doctors would actually go to your house. That doesn't happen any longer. So you got visiting nurses go to homes and all. Do you guys also pick up that pace and do it as well? How does that work?
Yeah, so we have, through the state, we have a mobile integrated healthcare license. So what that means is that we can do, our scope of practice as paramedics is increased, so we can do at-home care. And the idea behind that is more, you know, again, it's not an emergency setting, it's more preventative care. So let's say you're a COPD patient, you have a hard time breathing, and you know, you just need some IV steroids and some breathing treatments. We can go to your home, do breathing treatments, do steroids, antibiotic therapy. And Lieutenant Lockhart did a lot of work in getting us, we're actually a state certified lab. So we can draw blood work in your home, get results within 5 minutes, interpret those results, and then give you treatment based on that. We're actually licensed by, or accredited rather, by COLA, which is a highly astute accreditation center for a lab. So we're one of the few EMS departments in the state of Massachusetts that do that.
So this is when the paramedic degrees come in to do all this stuff, whereas you guys have to be really on top of this stuff, like a visiting nurse. And I had to, you know, I mentioned the question. I had a question one time about the qualification between you guys and nurses, but the nurses have a different degree than a paramedic, a step up from paramedics as far as their studies and stuff. Is that correct?
Yeah, I'm glad you asked that question, because it is the education is different as far as degrees. Paramedics, they're licensed, they're nationally and state licensed. So you go through first you have to be an EMT, which takes X amount of months, usually 3 months. Then you need experience. Then you go back for a paramedic. That in-classroom education takes, you know, anywhere from another year to a year and a half, and then you have to do an internship, an unpaid internship, which again usually takes about 6 months. So, you know, from EMT to paramedic, you're looking at minimum probably 3 years that it would take. You don't get a degree though, because it's, you know, it's usually not affiliated with a college program, although that is starting to trickle down. Nursing, you do need a degree. An associate's degree. There are a few diploma nursing programs still left, but that's transitioning to a associate's degree as well. So the training is a little bit different. However, scope of practice, some may say that paramedics can actually do more than nurses as far as scope of practice, but it depends what setting you're talking about, right? Yeah. In the back of an ambulance, paramedics can have all these standing orders. In the hospital, nurses have standing orders too, but they also have a physician usually right next to them that can give them different orders. we don't have that in the back of the ambulance. We'd have to make a phone call. We actually do have a couple nurses on staff at Fall River EMS, and we have a nurse practitioner.
Oh, see.
So we really try to cover all the bases as far as the services that we can provide with different type of professionals.
Yeah, I mean, you know, EMS has come a long way since when I started all this way back. We would just scoop up the people, throw them in the ambulance, and cut them off. Now it's medical attention. You actually intubate and medications before they get to the hospital to try to save their lives. Back in the day, that didn't happen. Research. I see you have something pertaining to research.
Yeah, so we're going to be starting, hopefully, this new study soon regarding antibiotic therapy in the field. So people who have really bad infections such as sepsis, we would take those blood machines that we have that we were just talking about, draw something called the lactate level. That lactate level would tell us essentially, you know, how bad your sepsis is, and then we would hang the antibiotic right then and there at the bedside in the patient's home before they get to the hospital, because what they've shown and what we're going to try to produce in our study is that the quicker you get those antibiotics, the better chance you have of surviving, because sepsis is very serious, and unfortunately a lot of people lose their lives because of that. But the faster we can intervene, the better, versus just throwing them into the ambulance, bringing them to the hospital, and then that creates a time delay in when you're getting that life-saving treatment.
So when you're doing these treatments, do you have to actually call the hospital, or are you guys authorized to do all that stuff behind in the ambulance?
So we have a preset number of protocols that we are allowed to follow based on a standing order. That's already been signed off by the state, and then we have a number of additional protocols that our medical director has signed off on us performing. This research that we're talking about would be in addition to that. So that's something that we would apply to the state to be able to conduct the study, and we would have a temporary standing order to do this sort of testing and administer those medications. The addition of antibiotics in the field is something that's coming from the state already. We're just trying to prove that it is something that will be effective in our community.
So this program, is it federally funded? These programs that you render to the public?
Some are, some aren't. The Bristol Aging program is federally funded. The vaccine program, I think for the most part, is federally funded. Other programs that we run, we kind of eat the costs in house, and just try to do what's right for the community.
So I guess my question is this also. A lot of talk about federal funding going away for public safety, home health care, a lot of this stuff. I was at the State House yesterday advocating for public safety grants. Of course, we spoke on behalf of EMA directors to the Senate and to the representatives. But even if we speak to them, it's not going to do any good, because if they're cut, it's going to be cut all through the board.
Yeah.
And unfortunately, this may affect some of these programs that you guys run to the public. Let's hope not. Safe stations. Let's talk about that for a moment.
Sure. So we've had a safe station program going for a few years now up in Fall River. Basically, what that is anybody with a drug addiction who wants to seek rehabilitation, who wants help for their problem, they can go to any fire station. That will activate something called the Safe Station Response, which is if there's not a paramedic in that firehouse for whatever reason, they'll activate the paramedic to respond. The paramedic will do initial assessment on the person and then contact something called a peer recovery coach. That peer recovery coach will come and facilitate with the paramedic and try to get that person a direct admit to rehab versus going to the hospital, waiting at the hospital, and then being discharged from the hospital. We'll take them via ambulance, in most cases, right to rehab, any rehab throughout the state, wherever we can find a bed. We've sent people to Worcester, we've sent people to Springfield, and then, obviously we try to keep them local if possible, just send them to STAR. STAR is usually at capacity.
Right. So that's good. And also the baby program, you can drop off a born child at the newly born at the stations as well, correct?
Correct. Thankfully, that's never happened in my tenure. Thank God. But that is a service that they can do as well.
And that's Safe Station also all combined to all of one of the stuff, right?
Yeah.
Yeah. On household population clinics, what is that pertaining to?
So the unhoused population, in Fall River.
The homeless you're referring to?
The homeless, yep.
Okay.
Is, unfortunately, that's a bad problem right now. So we try to partner with other agencies who are doing great work and provide different services, whether, we go out there and try to give vaccines, any type of resources that we have available, we try to pass along. Actually, after this meeting, we're going to be trying to collaborate with another agency on trying to set up wound clinics for the homeless population. Yeah.
Homeless population is a big problem in the city. I mean, every day you hear on the radio overdoses. You guys are going crazy all over the place, and it's an unfortunate situation. We're very concerned along the railroad tracks now with South Coast Rail coming in because we have a lot of homeless on the tracks. MBTA police and trying to get everybody off the tracks, keep the tracks clean, but it's tough because they have no place to go, unfortunately. Stroke events.
So another partnership that we have with St. Anne's Hospital is the World Stroke Event. So if you've suffered a stroke and been treated at St. Anne's Hospital, we work with a woman named Lisa DeMello. She'll facilitate your aftercare after you have that stroke. We partner with them, so we'll go out to your house, we'll do a home safety assessment, take your vital signs, make sure you're following your treatment plan appropriately. We'll educate you, focus on stress reduction, because that's a big concern with stroke patients is stress, high blood pressure, nutrition. And just make sure it's basically a continuum of care. From the hospital, you get treated for that stroke, you get sent home, and we want to make sure that you're still on the right path to succeeding.
So I see you have some pamphlets there, some flyers. Can you just hold those up so the people can see those? And where can they get those flyers and stuff?
So we have these at our office. This is the CARES program that we were talking about in the beginning of the show. This explains everything that we talked about in a little bit more detail and how to contact us. We have these in our office. We also drop these off at all the high rises in the city, senior center clinics. So we have them kind of spread throughout. This one here is the Health Care at Home program flyer. I distributed throughout all the doctor's offices in the city. We're trying to get doctors on board because this is going to be in collaboration with your doctor, your primary care physician. We work with them to provide treatment in your home.
Oh, good. So EMS has come a long way from when it was many, many years ago. Not just a medical rescue unit, it's home health care and helping the public, which is great. Anything else you want to elaborate on this stuff that we missed?
Yeah, I mean, so the idea of all of these programs together is like you said, it's an expansion of EMS from being, just the people that you call when you're having an immediate emergency to people who are more involved in the general public's health. Trying to make sure that people are healthy and succeeding at home and not just encountering us when they're having an emergency. This is something that, increases the quality of life for the people that we're working with, and that's something that we hear a lot back from when we have these encounters. But also, it's reducing some strain on the healthcare system as a whole. If we can keep these people healthy at home, then they're not returning to the hospital for repeat events, because the hospital, is not set up, and especially a lot of the hospitals now are so overwhelmed that they can't continue with this influx of patients. The more we can treat people out of the hospital and keep them safe at home, the better for the whole system.
You had something to say, Cap?
Yeah, I mean, I could just add on that a recent review that we had 2 weeks ago after one of these healthcare visits. It was a 102-year-old woman that our community paramedics went out to see. She lives by herself.
Wow.
She was very anxious. She had a lot of health problems. Our paramedics, we went into the home. We educated her. We made sure she knew that we were there for her. Whatever she needed. We provided some medical treatments for her, nebulizer treatments. We went through her meds with her. And then when the paramedics left, she actually called and said, I actually feel like I'm gonna be around a lot longer now. I wasn't sure how long I was gonna make it. So right there, that's an attestation to how good the work my guys are doing, and that made me very proud, to say the least.
It certainly is, and people are living longer and longer and longer and longer. So if someone needs these services, how do they contact and who do they contact?
So they can call me at the office directly. The phone number is 508-324-2744. And then you can just ask for me, Captain Matt Adams or Lieutenant Matt Lockhart, and we can get you hooked up with the services that you need.
Oh, good. So, you know, from what I see, it's a great service rendered to the public, the elderly, particularly those in need, and you guys always do a great job. I mean, weeks ago I had Captain Ferguson on regarding training and what the training process is to become a paramedic and EMT, and there's a lot of training involved in it, and you know, it's something that people should look up to you guys, because you saved their lives. Not only, I've seen it many times, as you guys know, being on different scenes and car accidents and fires, that how you save people's lives right in the scene in the ambulance. Most back in, like I said, I refer to way back in the day when I first started this stuff. There was nothing like it is today. I mean, a gunshot wound, a cop would go in the back of the ambulance, just make sure the guy don't jump out of the back of the ambulance. But there was no medical attention at all. You know, probably a compressor's hand down in a wound, and other than that, it was obscured medical attention. When you guys do everything. Home health care, it's amazing what you guys do. I appreciate you guys coming on today. I think the people received a lot of good information, and don't hesitate to call EMS, the captain or the lieutenant. They'll be glad to go help you. And thank you very much. That's our show on our view on public safety. Thank you very much.
Thank you.
Thank you for having us.
Sure.
Thank you, guys.